You know what? I've been in a healthcare community for over 20 years, and I've seen a lot of things change. And I think that one thing that's really missing is having our rights being okay.
We do not consent!
Give us our right to say no.
Stop the mandate!
A hospital once inundated with COVID patients, now the stage for a different battle.
My company could ask me to jump off a building if I wanted to. It doesn't mean I have to do it.
I don't believe I should have to make the choice to put this in my body to continue to do a job that I've been doing successfully for 14 years.
Asking us to do things that could be contrary to our own health and could be detrimental to our health for the sake of making other people feel comfortable, I don't believe is right.
TTS stands for the thrombosis thrombocytopenia syndrome, and it's a very rare immune problem after AstraZeneca vaccine. And what happens is that the antibodies that your body starts producing to the vaccine also start fighting against your own platelets and use them up, and it causes some bleeding problems and some clotting problems in particular. It's nothing like DVTs or pulmonary emboli or strokes or heart attacks. They're very different. This is actually sort of an immune problem where the body fights against the platelets. Hi, I'm Crispin Hajkovic. I'm the Director of Infectious Diseases at Royal Brisbane and Women's Hospital. The syndrome is very rare, so what we're really looking for is between days 4 and 20 after the vaccine, looking for severe headaches. The headaches don't respond to Panadol or Nurofen and they carry on, or severe abdominal pain or other really severe pain. In the over 50s, for where AstraZeneca is recommended, the rate of this syndrome is about 1 in 200,000. It's also important to point out, though, that we now have some treatments for this condition. We understand it a lot better than we did a few months ago, and as a result, the 11 Australians that have had this syndrome, most have now recovered completely, left hospital and gone back to work. I fully understand why people are worried about this. It's just extremely rare. We all accept risks every day that are greater than 1 in 200,000, and so it's got to be put into a bit of perspective. Every individual needs to make their own decision about accepting an AstraZeneca vaccine, but do think about, if you're over 60, that 1 in 30 chance of dying from COVID. 1 in 5 people with COVID get severe blood clots as well, and so you've got to balance up that risk. In the over 50 population, I personally feel that the risks of COVID are way higher than the risks associated with the AstraZeneca vaccine. Winter's coming up. COVID is clearly a seasonal virus. There are other factors at play, but there have been big outbreaks around the world in the winter months, and I really think it'd be pretty risky to hope that we don't have outbreaks through winter and leave it till next year or something like that. I really think now is the time to get vaccinated.
134,000. That is how many confirmed flu cases hit Missouri last year. And that is why it is so important to get vaccinated. On Monday, the Visiting Nurse Association begins its official campaign when it comes to getting your vaccination. They plan to vaccinate thousands of people. And guess who we have here? We have Jennifer Jones. She is an RN with Visiting Nurse Association of Missouri. Jennifer is here with information that you need to know as we head into flu season. Thanks so much for joining us this morning.
Thank you very much for having me.
Full disclosure,
yes,
Jessica and I just got a flu shot minutes ago.
Yes.
It literally took like 10 seconds.
Yes, yes. It's a very quick process.
Yes.
And pretty painless.
It is fairly painless.
Yes, yes.
Okay, so these numbers are staggering. 134,000 people who were officially confirmed with flu last year in Missouri, and 180 children died nationwide.
Yes.
So the flu can be fatal.
It can be. It can be, and people need to take that seriously because it is truly important to try to protect yourself and others from the flu, and by getting vaccinated, that will help you do so.
So their cries for help will not be in vain.
Hello everyone, my name is Van Nguyen and I'm a future nurse. A nurse needs to be vaccinated because nurses are the frontline worker and they are the heart of the hospital. It's very important to give vaccination to the nurses who are in the exposure working in the hospital.
My name is Denise Nieves and I'm a future nurse, and nurses must be mandated in order to stay consistent with our code of ethics and our ethical principles.
My name is Cassandra Nolasco and I am a future nurse. I believe nurses should be mandated to get the flu vaccine and eventually the COVID vaccine. Being vaccinated not only saves you, but it saves the people around you.
And the American Nurses Association issued a joint statement yesterday calling for all healthcare and long-term care employers to mandate their employees be fully vaccinated against COVID-19. American Nurses Association Dr. Ernest Grant. Given the changes even in the past 24 hours and the mandate to either get vaccinated or get tested, what has been the response among nurses across the country? And how does weekly testing really work compared to the vaccine?
Well, thank you very much for having me. There's been an extremely positive response to the mandate. Nurses are realizing that they need to be vaccinated in order to provide the care that is needed, and also to prevent the possibility of acquiring the virus and taking it home to their families, or spreading it to the people that they serve. And the differences between the weekly testing is that there's always the potential that right after an individual has been tested, they could acquire the virus and begin to start shedding the virus before the next time that they are due to be tested. So, that's the main differences between requiring the mandate and or the weekly testing.
There comes a time when we heed a certain call, when the world must come together as one. There are people dying. We are the world. We are the world. We are the children. We are the children. We are the ones who make a better day. So let's start giving.
This season, a flu vaccine is more important than ever to reduce the risk of flu for yourself, your family, and your community. It can also reduce the burden of flu illness on the healthcare system and save medical resources to care for people with COVID-19. The more people vaccinated, the more people protected. Get your flu vaccine to protect yourself and your loved ones.